That being said, I am absolutely in favor of hormone replacement, especially testosterone, TRT, for individuals who need it.
I'm also curious about this because we've been having this discussion a lot. Testosterone is something that is being used a lot, very liberally, especially within younger males. And I wonder, are there any, we know the benefits or some of the benefits, are there any potential drawbacks of long-term use for some individuals that, that are maybe just using it? And this is outside of individuals who are obese, who are in these situations where it's like maybe very necessary. Is there anything people really need to be thinking about?
I think age of use is very important to consider. One of the things that is, I believe that you should optimize your testosterone when you are young to your fullest capacity. I don't even believe that individuals should be thinking about it in their 20s. I mean, it just, again, it can shut down your own testosterone production. It can cause infertility. There are things that there can be issues with. Not everybody, and oftentimes they will recover, but it also sets the standard of not being capable, not being able to do and generate your own testosterone and feeling naturally. And I think that mentally can be a huge drawback. That being said, I am absolutely in favor of hormone replacement, especially testosterone, TRT, for individuals who need it.
Yeah.
There should be no reason that they shouldn't have it. And again, in society, I mean, listen, I was with Mark yesterday. The guy did not stop moving, right? His testosterone is probably 25,000. I don't know.
Probably.
But we don't live that way. We're very sedentary. A lot of individuals have excess visceral fat, excess abdominal obesity, things that can drive estrogen up, testosterone down. Sleep apnea is huge. All that being said, I think that you should do the things that you can when you are young and not make that transition, because typically once people go on testosterone, they don't come off.
In your practice for, you've had it for many years. Have you seen any changes with females that are coming to you? Are there different problems today than there were maybe when you started your practice? And do you have access to some better strategies today, or better drugs or better pharmaceuticals to assist with some of maybe what today's females are dealing with?
Yeah, this is a very challenging conversation because there are drugs that are well, first we have to say, when women are coming to me, the standards are very liberally set right now. So the standard for, say, obesity is at a certain level, right? So for example, a woman would come to me and say, I'm not happy with my body composition, but she might not be identified as obese. So drugs that I think that she would be very a great candidate for her, I may have some restrictions to use because she does not qualify as the medical standard of obese, which is really interesting. The medical community and the responsibility of a physician is to practice within guidelines.
What does that look like? Like, what is there some sort of percentage or body index?
It's right. So they have to be, it depends on body fat percentage. Typically, I don't use BMI. If an individual has 30% body fat, okay, then you can consider certain kinds of medications. But what about an individual that comes to me and is like, I just cannot lose these 10 pounds. And part of me would be like, wow, we should really initiate pharmaceutical therapy, but it's not within certain guidelines. And so that becomes a challenge. So I am seeing, so one of the questions that you asked, which is a very astute question, is, am I seeing things differently? And I would say, yes, I am not seeing things differently within the patient population. I see things differently with the amount of restrictions that physicians have. And that is a challenge.
So do you have, because I think Dan Garner has mentioned this, and a few other people have mentioned this on the podcast, how, for example, the guidelines for a normal testosterone range have gotten lower over the years. And I'm wondering too, is it the same thing for if an individual's obese, have they loosened up the reins on that?
They haven't loosened up the reins in recent years, but the testosterone phenomenon is actually very true. And these are challenges that I think that we're going to continue to see.
Are there differences like with some of the psychiatric medications? Have they, in your opinion, advanced much, or does it seem like it's, I mean, I know that's not your main area of expertise, but does it seem like with a lot of these people, it just helps more to help them with their body composition and the mind follows after, or how do you kind of see it?
Well, I think that, first of all, I think there's nothing wrong with pharmaceuticals. My practice philosophy is an integrative philosophy. I will use natural means when I can, and I will also use pharmacological agents because I do think that a practice is the best of both worlds. For example, I will use metformin, I will use semaglutide, I will use Mounjaro, I will use these medications that will help with insulin sensitivity and weight loss. And I also will use medications like Wellbutrin and Effexor, these top-down effects. I think that there's a benefit for all of them. Again, an individual, I do believe that individuals should not struggle.
One thing I noticed with you in my communication with you and my mother's communication with you, I remember you're the first person that will say, I need to point you in this person's direction. And I always admired that from you. That's a really great trait because you're like, yeah, I know a ton about this, but let me send you off to somebody that's a specialist in this actual field. And that's a great trait to have.
Thank you. When people are good at what they do and it's not about the person, they care more about the patient. And you cannot be a specialist in everything. And if someone is that way, then they're not a specialist. Because a true specialist knows what it actually takes. And also, it's about the patient. And if the patient comes first, there are things that I don't know. And not only that, if I'm unsure, even though I've been practicing for over a decade.
Power Project family, how's it going? So no matter what diet you're on or no matter what supplements you take, it's necessary as you get older to know what's going on under the hood. That's why I've partnered with Merrick Health. They're the premium telehealth clinic owned by Derek from More Plates, More Dates. And we have a panel that will allow you to get all of your labs done and checked in a super easy fashion. Andrew, how can they get it?
Yeah, you guys got to head over to merrickhealth.com/power project. That's MAREK health.com/power project. And at checkout, enter promo code Power Project to save $101 off of this comprehensive panel. Links to them down in the description, as well as the podcast show notes.
Why would I not communicate with someone who is a niche specialist in this area? For example, I take care of a lot of military operators. I take care of a lot of SEALs, SEALs transitioning out. They go away on deployments, they come home. I am not an infectious disease doctor. I will screen all of them for infectious disease. They all get significant stool tests, unfortunately, that I will send to Nigeria or, some kind of infectious.
See, sends her shit to Nigeria.
I mean, listen.
Take exception to that?
Your ass will do that
shit. But it's really important to,
picture it like being dropped out of a plane or something.
You are lucky. You are very lucky. The reason I bring that up is because, yes, there's a certain amount of knowledge that is required, what to look for, what to really think about. And then you do a deeper level of testing. Once you get those results, you have to send it out. You have to, medicine should be collaborative, just like your guys' industry.
Yeah.
Even if you guys were doing pedicures in the back and looking at your feet, and I don't know what's happening.
It's gotten weird.
We look at our feet a lot.
It's gotten really weird around
Very
here.
weird, yeah.
I can't work out under these conditions.
There's nothing wrong with pedicures. Actually, you both should probably get some.
I don't know. My feet.
I've had them before. They're great.
Aren't they?
I need another one. Yeah. They got
They
rid of some really awesome calluses I had though.
You would need a sledgehammer. I saw your feet.
Yeah.
You need the drill.
Right. Like a scene in Dumb and Dumber.
Yeah, that's a good scene. What about and I know it probably takes several steps to get there, but testosterone prescriptions for depression and that sort of thing.
It's not the primary. That's a great question. It's not a primary indication. At least, I have not seen it as a primary treatment. But of course, low testosterone can influence depression. So you do have to treat in entirety the whole person.
Yeah. So this is, again, it's interesting that you mentioned that we're on this discussion again, because we've been seeing comments from, again, a few people in our audience have had depression and then they chose to get on TRT and then that was the thing that, and I'm not saying this as this is why you need TRT, because I think that, I know that habits, getting sun, getting sleep, exercising, nutrition, all of these things can impact your testosterone and your hormones. But a lot of people, especially younger men, that's been the thing that they're turning towards. So, I mean, how do you look at that?
I think it plays a huge part. And my patients will say, man, I haven't been on testosterone. I'm feeling depressed.
Yeah.
And they will say it. I'm really feeling this. I don't feel motivated. I feel low. I don't feel like myself.
And these were people who were on testosterone?
Yeah. Yep.
Have you noticed an impact on men and women?
I do. I'm so glad you asked. I think that women, one of the things I do see with women is their testosterones are low. And their free testosterone is very low. And when they go on testosterone, they have more energy. Their sex drive improves. And I think their orgasms improve. I feel as if it's I feel as if it's undertreated and under-discussed, for sure.
Why do you think so many women are suffering from like many of the same things? Like I have some female friends, and it seems like a lot of prescribed thyroid medication. It seems like a lot of autoimmune disorders.
Tons.
What has this always been the case, or like what has maybe triggered some of these things? If you know any of that,
autoimmunity. When you think about autoimmunity, we should just briefly explain to the listener is that when it's the body attacks itself, and specifically women and thyroid autoimmunity, Hashimoto's, where the body is attacking either the thyroid hormone or the thyroid itself, has seemed to increase over the last decade. Why do we believe? I certainly can offer my opinion. I believe that we are up against a much more toxic environment. And this may be a little surprising. When I say toxic environment, I mean that I believe a lot of autoimmunity, so there's a genetic component and there's also an environmental trigger component. The environmental trigger component I often believe comes from gut infections, whether it's parasites or something happening.
Here you go again with your worms.
I know. I'm sorry, but I've just seen it. So
crazy.
I know. But hey, the proof is in the pudding. I get people better.
The proof is in the poop.
Yeah.
Nice one. The reality is we have a entire human race to feed globally. Hear me out. Which means we are getting food from all over the world. So now what's happening is whatever is on that food that we might not be exposed to here in the US is coming here. People are getting it, whether it's sushi being shipped or I don't know.
There's a lot of meat companies that you can order from, and it's from like Australia or some shit. Yeah.
And fruits and vegetables that are coming from other countries that are now coming here. So now we are exposed to, say, helminths or worms that typically you'll find them everywhere, but perhaps the burden level of what we're getting, and Mark is laughing.
Well, the worms that Nsima has are next level because he has he does a sushi sous vide out of his trunk of his car.
Right.
It's quite impressive.
I will say I never recommend anyone eating sushi. I've just
or
seen
anything
too
from
much.
Nsima.
Oh, so you don't even mess with sushi at this point.
Again,
when I cooked for her yesterday, she's like, I like my meat cooked a little bit more than that. And I was like, okay.
And again, this is just from clinical experience over the years. You asked about autoimmunity. When we start to see things introduced from all over, and listen, you'll hear people say they go out of the country, they get sick, I have this GI stuff, and subsequently they may develop Hashimoto's or some kind of autoimmune condition. I, of course, am making this very black and white. It doesn't necessarily just mean it is. There's a predisposition, there's environmental toxins, there's all kinds of things. But that is one of the reasons why I believe that we are seeing more autoimmunity. And another thing, and I don't know how much this contributes to this, but iodine's effect on the thyroid. We are using iodinized salt. There's a lot of iodine in skincare products and iodine in things that potentially it shouldn't have. And the iodine is really affecting the thyroid.
Do you think there's maybe some negative side effects of perfumes and makeup?
I do.
Because there's like a lot of stuff. Like I remember, I just don't even really look at it anymore. But I remember like
when you were wearing perfume and makeup.
Yeah, when I was wearing a lot of
last year.
When I was using a lot of blush last year. No, I remember like when my wife first moved in with me, and I remember or we moved in together, just like how many different like bottles of stuff she had like in the in the shower, and I was like, what the fuck is, like, where's the soap? Like, is there soap somewhere? There's like this cell volumizing something or other and this other thing. And these products just aren't, you know, you look at the ingredients, you're like, holy crap, like there's a lot of ingredients here. So like, I think makeup and perfumes and shampoos and conditioners, they must have like maybe some toxins in them or something like that.
I very much believe that over a lifetime, these things can be very toxic. And it's different for every individual. Some individuals have more of a capacity to be able to detoxify than others. And if an individual is predisposed to having issues, then you add on more of these environmental toxins. It's a real problem.
And you might be able to find alternative brands that don't have some of the parabens and some of the other things.
I agree.
Right?
You know, ultimately, I feel as if everything is going to cycle through. They're going to say, now it's parabens, it's these things, and then they're going to have natural products, and the natural products are going to have put in whatever it is. So ultimately, the more natural an individual can be, the better. Even though I use makeup all the time, and I have no issue with it, but I try to use a, quote, clean brand at the moment. But again, being cognizant of this stuff is really valuable. And if you're going to offset it with what you're eating.
Yeah.
Right.
Hey, baby. I'm joking. Guys, like, comment, subscribe, and head to the Power Project Discord, all right? I know you enjoyed the video. Speak to y'all soon.